Chronic kidney disease, or CKD, is one of the biggest problems faced by the NHS in Britain. The number of people with serious health problems is on the rise in the UK, so it's as important as ever that the public fully understand what kidney disease is and how best to prevent and treat it. As I said before, kidney disease is extremely prevalent in the UK and, according to the NHS, it's affecting more and more people every day. Around 1 in 10 people in this country are diagnosed with chronic kidney disease. Chronic meaning that it doesn't get any better. What's more, around half the people aged above 75 have CKD, and this is usually onset from lifestyle choices they've made earlier in life. By informing people earlier about the choices they're making and what implications they're having on their health, we can prevent CKD before it happens. There are several different treatments for CKD which our National Health Service offers us, costing the taxpayer around £1.4 billion each year. But to first understand how kidneys are treated, it's probably best to understand what their job is in the body and what can go wrong with them. The kidneys are part of the renal system, which is responsible for the expulsion of waste and homeostatic control within the body. They're found in the retroperitoneum and are extremely important organs, which is why we have two of them. In case one stops working, there's another one to back them up. They have many important functions, including regulation. The kidneys are responsible for maintaining a constant internal environment within the body and are the sole location of all homeostatic controls in the urinary system. Catabolism. A series of metabolic pathways within the sites of the kidney allow for the synthesis of insulin, calcitonin, and parathyroid hormone. Endocrine. An amalgamation of glands is responsible for synthesizing renin, erythropoietin, and prostaglandins, all of which are involved in homeostasis. Another prominent role of the kidney is its ability to filter waste products from the blood. This is done by a nephron, which is also responsible for tubular reabsorption and secretion. And each kidney has around 1 million of these subunits. A nephron has two main components. One is a Bowman's capsule. This encloses a bundle of capillaries called the glomerulus. Blood pressure forces out small particles like water, glucose, salts, urea, and other substances through its semi-permeable membrane. Because the glomerulus has a large surface area in contact with the Bowman's capsule, it means that millions of these particles can be filtered out at one time. There's also a renal tubule. Because the filtrate is similar to blood plasma, reabsorption must occur by the renal tubule coming in contact with a series of tubes, called peritubular capillaries. This is where those essential particles like water and glucose are returned back into the bloodstream, again through a semi-permeable membrane. When this system stops working, it's called renal failure. It's a very serious condition which you can die within 2 weeks of, because the salt in your blood will cause high blood pressure and the urea in your blood will poison you. Thankfully though, it is treatable. Hemodialysis is perhaps the most obvious answer. This is when a dialysis machine emulates the function of a nephron. A dialysis patient would first undergo an operation to insert a fistula into their arm to allow for vascular access. Then, blood is put through a capsule called a dialyzer, with help from a machine to pump it around. Inside the capsule are extremely thin fibres, which work like a membrane. Then, dialysate solution is also pumped into the capsule. Salt, urea and other substances diffuse through the fibres out of the blood and into the dialysate. And now, the clean blood can now go back into the body and the waste dialysate is discarded. This was a very clever solution first theorised by the Scottish chemist Thomas Graham in 1861. Following on from his research, George Haas, a German, was able to perform the first hemodialysis in Nuremberg. Johann Kolff, a Dutchman, built the first working hemodialysis machine in Leiden in the Netherlands, and the technology has continued to be improved and refined ever since. However, there are problems with the technology. Patients need to spend around 3 hours on the machine 3 times a week. Side effects are commonly associated with the treatment and could range from sleep disorders to bone disease. Patients often feel tired after treatment and feel they have little energy to do anything later on in the day. Having said this, however, the technology has been improving and institutions are committing more and more research to this cause. The technology has already been made so accessible, for example, that an increasing number of people are now choosing to perform the dialysis on themselves in the comfort of their own home. A similar treatment is peritoneal dialysis, developed from the technology that made hemodialysis possible. It involves the dialysate being inside the body and utilising the peritoneal membrane, a naturally occurring semi-permeable membrane which surrounds the intestines. A Tenkov catheter, or soft, thin tube, is surgically inserted into a patient's abdomen, and this gives access to the peritoneal cavity. This cavity exists between the inside of the skin and the outside of the intestines, which are covered in a membrane, so it makes for an ideal artificial kidney. Dialysate is run into the cavity using the catheter, and filtering occurs passively throughout the day. There are two types of peritoneal dialysis. CAPD works while the patient is active, and the fluid is changed around 4 times a day. It takes about half an hour to replace the dialysate. There's also APD, where a machine pumps dialysate through the cavity while the patient sleeps for 8 to 10 hours. Some fluid is left in the cavity so they can go about their lives while they're awake. The main benefit of peritoneal dialysis over regular dialysis is that it gives the patient much more freedom to live their life while undergoing the treatment. But infection is a much greater risk, and after a while, when the membrane thickens because of the treatment, patients might have to move on to full hemodialysis. A kidney transplant might also be a viable option. Around 45% of those with renal failure have undergone a successful transplant, with over 1,500 taking place every year. It may seem a perfect solution at first glance, but there are many drawbacks. Kidneys can only be transplanted if the donor is matched with a patient who needs one. Patients also require to take immunosuppressants after the surgery to stop the body from rejecting it. These can increase the chances of catching other illnesses, and even after taking them, kidneys sometimes only last a year, with 50% of transplants lasting more than 15 years. The cost of performing a single transplant costs £17,500, plus an extra £5,000 for the immunosuppressant drugs. For the treatment to be improved, many industries are striving to improve immunosuppressant technology. For acute renal failure, hemofiltration is viable. This is similar to hemodialysis but works by convection rather than diffusion. It's offered to patients in intensive care who also suffer from low blood pressure, and patients can recover from the failure. High pressure forces the clean blood and particles to separate from one another, and this also increases blood pressure to a suitable level in the patient. But this needs to be done almost constantly until the kidneys begin to function again, and because of this, it is usually unsuitable outside of intensive care. Of course, these treatments are given after kidney failure, but there are several symptoms which may be indicative of kidney disease. A survey was conducted prior to the making of this video to gauge public awareness of these symptoms and the life choices which can be made to prevent CKD, with many of the questions utilising the Likert scale of questioning. The demographic was 57% male, and the majority surveyed were students under 21 years old. 28% also described themselves as professionals. The study was created in collaboration with a surgeon at Nine Wells Hospital. It was shown in the survey that most people understood the function of the kidneys, with the majority strongly agreeing that all humans and animals require functioning kidneys to survive. 74% strongly agreed that they need an adequate blood supply, and 69% said that this blood supply can be affected by lifestyle choices. Those surveys were also knowledgeable of kidney treatment. The majority chose correctly on how many times a hemodialysis patient would need to attend hospital a week, and for how long. When asked about other treatments available, 14 people mentioned transplants, while 34 out of 78 people skipped or said they didn't know. 7 people mentioned drug treatment, but the drugs usually given are in fact for immunosuppression against a transplanted kidney. 22% of people thought that patients could survive without functioning kidneys, but without treatment this is untrue. As mentioned before, severe CKD that goes untreated can kill in 2 weeks, so it's important to identify any symptoms that are there. The main symptoms attributed to CKD is general pain in the body, inflammation, rashes and nausea, all caused by increased levels of urea in the blood. Changes in how much you might usually go to the bathroom is also indicative, and you might even get a taste of metal as urea is broken down into ammonia in the mouth. The majority of people surveyed did identify these factors, but the taste of metal was the least identified, with only around 27% of people knowing this. Unfortunately, some people will just be born with poor kidney function, and the majority of respondents understood this. A lot of research is going into discovering hereditary factors which might affect the likelihood of contracting CKD, and some of these include a history of CKD or cardiovascular disease in the family lineage. 77% of the cohort believe that males were more affected by CKD, but this is actually untrue. Women are 5% more likely than men to contract CKD later in life. It is important that the public understand this, and if you are a woman, you should be more wary of the symptoms of CKD. Those surveyed also correctly identified that it was usually older people diagnosed with CKD. But this isn't to say that young people aren't affected at all, especially children. Acute renal failure sometimes occurs in them, but it is usually curable if the symptoms are correctly identified. If you're above the age of 60, it is very important that you consult a doctor if you have any of the symptoms described. Again, due to half the elderly population of the UK having some form of CKD. Infections contracted, either naturally or from surgery, can also cause CKD. This usually happens when the infection travels up the urinary tract and into the kidney, damaging it. 75% of the people agreed that this was the case, so if you're diagnosed with an infection, you should be on the lookout for some of the symptoms of CKD too. However, there are several modifiable factors which can dictate whether you get CKD or not. One of the biggest contributing factors is having high blood pressure, which is sometimes onset from stress. so it's important that people have a healthy mind to go with a healthy body. Only 60% agreed that having a healthy mind was important, so the public must be more aware to look after themselves mentally as well as physically. Blood pressure can also be brought down with regular exercise, like a sport. The majority of those surveyed thought that sports was really important in a healthy individual, so that's really promising. But any form of regular exercise will do. Substance abuse is also a major contributing factor, especially smoking and drinking. Luckily, the public was able to identify this, with the majority agreeing that they are damaging. But only 47% strongly agreed that smoking can damage kidney function. The public needs to understand that smoking can damage every part of the body, not just your lungs. Recreational drugs can also cause damage, and over 70% of people were aware of this. However, some prescribed drugs, especially painkillers called NSAIDs, can cause major damage too. 18% of people didn't know this, so be sure to ask your doctor about the possibility of CKD onset from painkillers. The statement, "there are other factors in life which are more important than healthy living," proved to be really controversial. 10% of people thought wealth was more important than health, and some didn't think it was important to try and convince others to live healthily. The fact of the matter is that chronic kidney disease is extremely debilitating, and the treatments in their present form, while revolutionary, puts a big constraint on your freedom in life. It's in my opinion that healthy living can be just as important as some of the other factors in life. Everybody should be made aware of the implications that their lifestyle is having on their health, especially their kidneys. So where can you go if you want to find out more information? Well, the NHS website has several comprehensive articles about kidney disease and how to prevent it. The American National Kidney Disease Programme also has a lot of details, and Kidney Research UK can tell you all about kidneys and maybe even about donating one later in life. Thank you all for watching this video, and thanks to everyone who conducted my survey, and I hope you've all enjoyed it.